liver cysts and liver abscesses. I'll be differentiating between the pyogenic abscess, the amoebic abscess, the hydatid cyst, and a simple hepatic cyst. And we'll be talking about what causes these cysts and abscesses, some risk factors, the patient characteristics, signs, symptoms, diagnostics, and treatment. Let's get started. First is this pyogenic abscess. The agent here is bacteria, and it's usually polymicrobial. This is the worst of the ones on this list. This is probably the second worst, and these two are less severe. So I guess it's in decreasing severity. The risk factors here are recent surgery or comorbid, like biliary tract disease. So somebody might have gallstones, or they might have diverticulitis, or another infection somewhere in the abdomen that spreads, where bacteria gets to the liver and creates a pyogenic abscess. Diabetes is another risk factor as well. This usually happens in older people, like 50s, 60s, or older, and it's equally in male and female. The signs and symptoms, as I said, this was the most severe: high fever, malaise, acute, ill appearing. They won't just walk in, be feeling okay. This usually isn't an incidental finding. They usually have pretty bad right upper quadrant pain and diaphragmatic irritation. Labs, you'll have positive blood cultures. They could just be septic, very high bilirubins, very high liver transaminases, and high white blood cells. So they're pretty sick. Imaging, you'll do some kind of imaging of the stomach. It could be an abdominal CT, abdominal ultrasound. You'll see a well-defined hypoattenuating round lesion, and they might also have multiple abscesses, depending on how bad it is or if it's spread, stuff like that. So treatment and management. For this one, you want to do IV antibiotics. You want to drain the abscess, and you might place a catheter if it's especially large or if it's difficult to drain. If you usually can't surgically drain it, you usually surgically drain it if it's not amenable to percutaneous aspiration. So you might work with like VIR and see how easy it is to get access to it, and if it's difficult, you might need surgery to get rid of it. So next is amoebic abscess. The agent here is Entamoeba histolytica. This is a parasite, a protozoa. The risk factors here are travel or residence into a resource-limited area with contaminated food and water. So this is a gut bug that you end up eating that kind of spreads to the liver through the portal vein. This usually presents in younger people, men more than women for some reason. This one can be asymptomatic, but they usually have like fever and diarrhea. The diarrhea can be bloody or mucoid. As I said, it's a gut bug that spreads to the liver. They could have right upper quadrant pain, not necessarily. They could have pleural effusion, not necessarily. Lab findings, you'll have high white blood cells, you'll have alk-Phos elevated, you'll have mildly elevated transaminases, not as much as in the pyogenic abscess. On imaging, you'll see a smooth cystic subcapsular mass. The diagnosis can be confirmed with amoebic serology, so it's a PCR or an antigen test for Entamoeba histolytica. The predominant symptom that you'll probably see is that diarrhea, bloody mucoid diarrhea. Treatment here is medical. You do not do surgery for this one. Some medications are metronidazole or tinidazole with an intraluminal antibiotic, like paromomycin would be an intraluminal antibiotic. So medical treatment for amoebic abscess. Next is hydatid cyst. The agent here is echinococcus. This is a tapeworm, so this is a helminthic infection. The risk here is travel or residency to an endemic area and interaction with farm animals. It's in dogs and sheep. So a prompt or a patient might tell you that they've had dogs for 20 years, or they worked on a farm in a rural area and they worked with sheep. This is also usually in younger people. Again, less symptomatic than the more severe pyogenic abscess. This could be asymptomatic for years before presentation. They might have right upper quadrant pain. They might have hepatosplenomegaly. They might have cough and hemoptysis. You can also have these cysts in the lungs as well, but not necessarily. They could be completely asymptomatic. Labs and findings, you'll have eosinophilia. Here it is a helminthic infection. You'll have a large and smooth cyst. It might have internal septations. This is essentially like daughter cysts refer to the same thing. It's like splitting amongst itself, internal septations. You can also see egg cell calcifications on imaging. And as I mentioned, you can also have lung cysts that could cause cough and hemoptysis as well. You'll confirm the diagnosis with an IgG of granulosis hydatid serology. And the treatment for this one is surgery and albendazole. The aspiration is not recommended in these patients. There's a risk of anaphylactic shock if the cyst spills throughout the body. But aspiration might be required for cysts that are much larger if the medical treatment and surgery is too difficult. Lastly is simple hepatic cyst. There's not really an agent for this. The pathophysiology here is epithelial lining that secretes fluid. These are believed to be congenital. There's not really much to do about them. They're usually asymptomatic. They might have a dull right upper quadrant pain. You might have abdominal bloating. You might have early satiety, but oftentimes they're just asymptomatic. They're usually incidental findings. You won't see calcifications. You won't see any malignant features or spiculations or any weird stuff on imaging. They're just benign hepatic cysts. Not much else to say about them. I hope this review was helpful.